Hi everyone, good afternoon. I am Dr. Seyi and welcome to Case Study with Dr. Seyi. And today I have one of our clients. He's a 37-year-old man and his biggest problem was the stomach. He was always bloated and he experienced a lot of stomach pain after every meal. After every meal, he gets bloated. He has a frequent history of constipation and diarrhea. He has seen two gastroenterologists, that is, two doctors that have a specialty in treating the gut, the digestive system. That's a specialty. They gave him an endoscope test and was told that everything is fine and he was placed on antacid. But for 3 years, he had no results. He has been on antacid for 3 years and he got tired of using antacid, so he was referred to me for a second opinion, and I made a diagnosis of IBS, that is inflammatory bowel syndrome, and LGS, which is a leaky gut syndrome. Those were the two diagnoses I made, and the IBS was as a result of the leaky gut syndrome. So during evaluation house, I found out that his food was his problem. This was typical for him. But we have other clients that could pinpoint that, oh, this was the reason for their own problem. But for this particular client, his food was his problem. So we made corrections, about to his diet, and we also corrected the nutritional imbalances that we found on his test, and we corrected that using appropriate supplements. A 6 week review was done, and his symptoms reduced drastically. He came back to us and told us that, oh my, I feel much more better now. Basically, my experience with IBS, that is inflammatory bowel syndrome, like I said earlier, it can be so multifactorial, like there are different causes. But the most common reason people develop IBS is as a result of maybe leaky gut syndrome that I mentioned earlier. That this particular client, the inflammatory bowel syndrome he had was as a result of the leaky gut syndrome. It could also be as a result of food allergies, bacteria, fungi, yeast, or parasite overgrowth, which we call these bowel cysts in gut health. When substance gets absorbed into your gut that shouldn't be there due to leaky gut syndrome, antibodies and other inflammatory molecules are produced. This is why the first thing we do when we see IBS patients is take a complete dietary history. We want to know what they have been taking, what they have been eating over the years. So, and I found out that eating an unhealthy diet that consists of too many refined food. This refined food lack basic nutrients, minerals, vitamins, and they also lack the good bacteria that our stomach need to function optimally. And one of the foods that I've realized makes this condition worse is milk or any dairy containing food, and gluten containing food too. These two people with IBS, I feel they should be avoided if you really want your symptoms to get better. So if you find yourself in this situation, or you are experiencing any of the symptoms I mentioned earlier that Mr. B, let me just say Mr. B experienced, such as the fullness, gets bloated after food, diarrhea, constipation, too much abdominal stomach pain. Anytime he eats, the stomach pains him. If you're experiencing any of this, or you know anybody that is experiencing any of this, just kindly refer them to us. We have solutions to gut health issues. I mean, serious gut health issues, we have solutions to them. We understand the foundation, we understand the gut health, we understand everything involved, and we provide appropriate solution to get you better and ensure that you live optimally. Thank you.